Here today we are here to discuss about yellow teeth. So, what are the causes of yellow teeth and what is yellow teeth actually? So, coming to the causes, I would have to classify these causes into two different categories. It will be intrinsic, which are the systemic factors, which we say it is intrinsic. The general factors, which we can commonly say, and the external factors, that is extrinsic factors, which are local factors. First, I'll try to tell you what are the common intrinsic factors which may cause the yellowing of your teeth. So, intrinsic factors coming, they may even start when you are present in your mother's womb, because during that condition, depending on what type of antibiotics your mother is taking, this may also lead to yellowing of your teeth when you're born. So, that is one factor which is starting. Then, after that, during the developing of your teeth, once you're in the age of 3 to 6 years, that is the time where your teeth are developing. During that period, when you're suffering from fever or any other sickness, those factors also influence, like taking of antibiotics, antihistamines, antipsychotic drugs. So these drugs may also influence the color of your teeth, which may lead to yellowing of your teeth. These are all the factors, the general factors also relating to your yellowing of teeth. One very rare factors which are present also are genetic, which are very rare. This may hinder the development of your enamel and dentin. These genetic factors also influence the color of your teeth, which may give them a yellowish tint. So these are all the very rare type of factors which are present, which are called intrinsic factors, which are general factors, which have very less control and which cannot be controlled while they are occurring. So, coming to the extrinsic factors, which are the local factors, which are more or less depending on your lifestyle. So, improper brushing would be the most common thing. When you're not brushing properly, the scales which form on your tooth surfaces and stains, which may give you yellowing of your teeth. Eating more of a junk foods and other things also will lead to this. And munching on different betel nuts, pan masalas, and other things also may lead to discoloration and yellowing of your teeth. One most important thing is fluorosis. Fluorosis is the most common intrinsic factor, which is the generalized factor which is present in the general public. This occurs when during the developing period of a child, between 3 to 6 years, when he is intaking untreated groundwater which contains high amount of fluorine in the water. This will give to bands of yellowish discoloration on your tooth. This is by far the most common intrinsic factor which is present in the general public. So these are all the basic, the causes of discoloration or yellowing of your teeth. I'll also divide the treatment part into two parts, like intrinsic and extrinsic. For intrinsic, you have to have a proper guidance with your gynecologist or your pediatrician before using any type of medication during the developing age or in the pregnancy of the mother, that those drugs would not influence any systemic problems like teeth yellowing or something of developmental problems in your tooth also. So this guidance should be there from your a pediatrician before using any heavy antibiotics or any kind of medication. That would be one part of it. And coming to the fluorosis, during that developing period itself, you should see that the parents should take responsibility that the water which they are giving to their children is not untreated, which is called TDS, which is present to the water, which gives the water's measurement of salts present in the water. If the TDS is more than 600 to 700, that means the water contains more salts and fluorine in the water. So that kind of water, which when the child intakes, that gives discoloration to the tooth, and that becomes a permanent kind of situation where the problem is, the rectification of the problem would be very difficult. That should be the main important thing in intrinsic factor of fluorosis, where the parents have to take care that whatever water they are giving to their children is treated or it is mineralized at least. Then these are all the intrinsic treatments what we can avoid them to see that there are no yellow teeth. Then coming to the external factors. External factors are simple. You just have to brush your teeth properly, maintain your oral hygiene well. Brushing twice is most important thing in that. When you're brushing your teeth properly for 2 times and assessing your oral hygiene on a regular basis and visiting your dentist on a regular basis, that should avoid the external factors, whatever it may be, from yellowing your teeth. Brush properly. That is what I would suggest for external factors. And intrinsic factors, you have to take care what you are intaking during the developing age of your children. That will be the responsibility of the parents. And brushing your teeth is the most important thing. Most important thing, brushing twice, and seeing that avoiding junk food, avoiding stained food from outside. Even though you're using them, seeing that you're brushing off the stains regularly. And most important thing would be regularly visiting your dentist on a periodic visits, like such as once in 6 months to once in 1 year for assessment.